Did you sleep well last night?
Believe it or not, humans have struggled with sleep for thousands of years. People have tried many different ways to fall asleep, and over time, sleeping pills have evolved too. Today's topic is the mechanism of action and the evolution of sleeping pills. Let's take a journey through history to see how humans have discovered the switch for sleep. Even in ancient times, people had trouble sleeping, but of course, they didn't have modern sleeping pills. Instead, they used the power of nature to help them sleep. One example is opium. Opium comes from the poppy plant and works on opioid receptors in the brain. It binds to these receptors and slows down the central nervous system. This leads to sedation, pain relief, and drowsiness. It also increases dopamine release, creating a sense of euphoria. However, opium is highly addictive, and misuse can be very dangerous. A milder alternative was valerian, also known as Valeriana officinalis. Valerian works by blocking the reuptake of GABA, which increases the amount of GABA in the brain. GABA is like the brake pedal for the brain. This helps promote relaxation, mild sedation, and natural sleepiness. People also used wine and alcohol as sleep aids. Alcohol activates GABA receptors, which helps calm the nervous system. It also blocks NMDA receptors. The NMDA receptor is a type of receptor that receives glutamate, an excitatory neurotransmitter. When this receptor is activated, nerve cells become more active, helping to maintain a wakeful state. Alcohol blocks NMDA receptors, which reduces wakefulness and makes you feel sleepy. However, as the alcohol wears off, your brain tries to regain balance, which can cause sleep disruptions and make you wake up more often during the night. This is one reason why alcohol lowers sleep quality. Alcohol doesn't lower sleep quality only by blocking NMDA receptors. GABA helps calm the brain by reducing nerve excitement. However, as time passes, GABA's effects weaken, and the sympathetic nervous system, which keeps you alert, becomes more active. This can cause sleep disruptions. Alcohol suppresses the production of melatonin, the hormone that controls sleep. This disrupts your natural sleep rhythm, leading to lower sleep quality. Alcohol reduces REM sleep, the stage when your brain processes memories and recovers. Without enough REM sleep, you may wake up feeling groggy and less refreshed the next. These are why drinking alcohol before bed lowers sleep quality. With the Industrial Revolution, chemically made sleeping aids appeared. The first ones were morphine and codeine, both derived from opium. Morphine binds to opioid mu receptors, causing pain relief and sedation. However, it also suppresses breathing and is highly addictive, so it wasn't widely used as a sleeping aid. Codeine is a weaker opioid that the body partially converts into morphine. It has mild sedative effects, but is mainly used as a painkiller and cough suppressant today. Then came chloral hydrate. Once inside the body, it turns into trichloroethanol, which activates GABA receptors. This was the first chemically made sleeping pill and was widely used. However, it had strong side effects and was addictive, so its use declined over time. Another major development in this era was barbiturates. Barbiturates strongly activate GABA receptors, causing powerful sedation and sleep induction. However, overdosing could be fatal, leading to safety concerns.
In the 1950s, a breakthrough occurred with benzodiazepines. These drugs bind to GABA A receptors and gently increase the effects of GABA. Famous examples include diazepam and lorazepam. These are still used for seizure treatment today. Benzodiazepines were much safer than barbiturates and revolutionized insomnia treatment. However, long-term use led to dependency problems. To solve these problems, scientists developed Z-drugs. For example, zolpidem binds selectively to a specific part of the GABA A receptor alpha-1 subunit. This reduces muscle relaxation and dependency risk, making it a better sleep aid. At the same time, researchers developed melatonin receptor agonists like Ramelteon. Instead of working on GABA, this drug activates melatonin receptors to help regulate the body's sleep-wake cycle. This allows for a more natural way to promote sleep.
The newest class of sleeping pills doesn't make you sleepy, instead, it blocks wakefulness. These drugs target orexin receptors, which control alertness. Examples include suvorexant and lemborexant. These drugs block orexin, allowing the body's natural sleepiness to take over. They have lower addiction risks and are safer for elderly patients.
The target of sleeping pills has evolved over time. Each step has made sleeping pills safer and more effective. What do you think an ideal sleeping pill should be like? Let us know in the comments.
Quick, powerful review. This is the only channel. Don't forget to subscribe.